This is a case of a urinary bladder malignancy, which is not depicted well in this CT scan. However, it is known, and the urinary bladder is catheterized, and there is a right-sided ureteric catheter. This is the lower aspect of the catheter and goes through the right ureter up and stops here. Here is the right kidney, and we can see dilated right renal pelvis and pelvic calyceal system. Not so significant, but there is dilatation anyway. I would like to show the findings here and the complications of this malposition or migration. We don't really know the cause why the upper aspect of the right ureteric catheter is not into the right renal pelvis, but anyway, this is the culprit cause of this situation. We can see here that there are ongoing inflammatory changes in the right retroperitoneum, and we can see fat stranding, traces of fluid, and all this area suffers. The anterior aspect of the right iliopsoas muscle is obscured comparing to the left side, and the right psoas muscle is swollen as well. So this is something ongoing, and impending collection should be considered in this case. Another thing is that there are some changes in the duodenum right here. Unfortunately, this patient has some chronic diverticula in the duodenum, but near the inflammatory changes in the duodenum, there is the malpositioned ureteric catheter. Just keep it in mind, and let's see the stomach now. The stomach is significantly dilated, and if we follow and track the stomach, just follow my arrow. Here starts the duodenum. Okay, it is dilated as well, and at this point there is stenosis. So there is strong evidence that there is a degree of obstruction, gastric outflow compromise, probably due to luminal stenosis of the duodenum due to inflammatory changes. Okay, as you see, the third part of the duodenum is collapsed, and the rest of the small bowel is also collapsed. So there is gastric obstruction at this point. The underlying cause of the reduced gastric output could be either a complication of the pre-existing diverticula of the duodenum, or secondary inflammatory changes to the duodenum from the malpositioned right ureteric catheter. But anyway, the gastric obstruction is a definite fact, as you can see. Just for comparison, I will show you the previous CT scan. It was done 1 month ago, and we can see the stomach, which is normal. The duodenum right here shows the diverticula, and there is no evidence of gastric obstruction. Unfortunately, the right ureteric catheter is malpositioned here, So after a month, probably these complications I explained you and showed you previously were well developed. Probably most of them you have noticed that there is a dilatation of the biliary tract and pneumobilia, and there is stenting of the common bile duct right here. So another possible complication of the gastric dilatation and obstruction could be this. So all these possible underlying pathologies should be under consideration when we report a complex case like this, particularly if there are multiple catheters or stents. Thank you for watching. See you the next time.